I'm Glenn McGinnis. Welcome to Outburst. From pensions to poverty, housing to healthcare, Canada's seniors face critical challenges at every turn. This week, we'll see Canadians of all ages talk about growing older in Canada. But first, we hear from seniors themselves.
Some of the seniors who are not getting enough money to live on. Housing is another big one.
They need help with their medications. If you start getting 10 prescriptions instead of 1.
So seniors don't seem to want to live in small communities, they want to live in larger areas.
We do our best work, many, when we're over 60 or 70.
It's not just building seniors' home or senior citizens' homes, and that's going to be enough. There's got to be a very organized and very structured way of how do you help citizens who are in seniors' homes. Not to just abandon them and say, okay, here's your room and that's it, and someone will come and visit. It's got to be a multidisciplinary type of approach where you have to have caseworkers, you have to have social workers. Every individual, especially with seniors, their needs are different, and they're very vulnerable at this stage in their life. My name is Morton Minc, and I was Chief Judge or Président of the Municipal Court of Montreal. Well, the innovations or the things that we did bring to the court with my colleagues was, of course, the social programs. We created a court for the abuse of the elderly. And especially with the question of the elderly, the reason why we thought it was necessary to have a court devoted for this program was that we found that more and more there was an abuse of elder persons, whether it was by family members or in fact it was an abuse by others. It was either financial fraud or in fact physical and sexual abuse of the elder people. We had to find out what is the reason behind the person having committed the offense. And having entered and then having created this court, we were able to not only look at it from a punitive point of view, but more from a rehabilitative point of view, and to have the problem that is out there acknowledged. And our court was there to see how we can resolve situations rather than traditional justice, meaning punish the accused and not addressing the issue, or helping also the victim in that case. We found it was absolutely necessary to see how we could help and address the problem in our own way. It's not a national way that we could do things, but as a court within our jurisdiction, we want to address that situation, and also perhaps by doing so, it would also sensitize other organizations in other courts perhaps to take the same steps.
Morton S. Minc.
This recognition is very special in my life and my family's life, of course, from a personal perspective. But I look upon it, and when I heard all the accomplishments of my fellow recipients, it's quite gratifying to see that so many people do so many great things for this country.
How can Canada better serve seniors?
I know, more support. I think it's better pensions for them.
Showing more respect, maybe taking the time to listen to what they have to say and not just ignoring them because maybe you think they're old.
Healthcare. I think we have to invest more in healthcare.
I just know there is a problem with the seniors' home, and we have more seniors and not enough places to put them.
Because I'm living on a senior's home right now, and they can come in and help us out a bit more.
Well, I know from where I come from in Miramichi, they're working to build better senior homes rather than just having them stay in the hospital and just having ones where people don't really care for seniors. They're actually building better homes like in Miramichi where people can actually see like their parents, their grandparents, and seniors that actually get the care they deserve here.
The seniors right now, they get their pension. By the time I'm a senior, I will have no pension. So right now they're doing just fine. That's my opinion.
Like I just retired a couple years ago, and if I didn't have my RSPs in place, I couldn't live on what Canada gets for a pension. The old age pension, they say you're entitled to the old age pension as if they're giving it to us, but that's money that we have earned. I've worked 55 years, and every week they take out money for Canada pension, and they say they're giving it to us. It's not their money, it's ours.
As a kin student, we talk a lot about kind of promoting physical activity like for life and physical like wellness as a whole. So I think maybe just offering more programs for the seniors. I know like there's sports like pickleball that are becoming huge for seniors, but just giving them more opportunities to get active in the community as well, like, I don't know, more walking groups and things like that.
I think it's your obligation as a human being to help take care of people who can't physically take care of themselves. And a lot of people don't have the training to take care of seniors because it's not like you're handling a baby that you can hold in one hand. And there comes a problem that you need to be, because they have free minds, unlike babies, that you need to be persuasive and you need to help them, and you need training to do that.
So I think a lot more should be done for our seniors. Give them a decent standard of living at the minimum, and let them live better.
I'm right on the doorstep of that one. Well, I think part of it is obviously, I think the pensions are a problem. There's a lot of people that can't live on the pension they're getting if all they're getting is old age and a supplement. I have a mother-in-law who's 96 years of age, and that's pretty much everything she gets. And you know, I mean, she doesn't demand a lot. It's not like she has an automobile or a mortgage to pay, but still, you know, the creature comforts of life are pretty hard to get on what you get for a pension from the federal government. I truly think that, you know, that's got to be seriously looked at, and more money's got to be put toward that problem.
I think Canada could better serve seniors by making sure that we respect them, that we take care of them, and try to provide and help wherever we can, financially and socially.
What percentage of the Canadian population is over the age of 65?
I want it maybe 60%. No.
I don't know if I would throw a number out, 20%?
35.
31.
Your choices are 7%, 17%, or 47%.
17.
47.
17. 17. 17.
It's 17. Yeah! Approximately 17% of Canadians are 65 and over, according to the most recent census. It was the first time a census found seniors outnumbering children under 14, and it also predicts that in just a little over a decade, by 2031, 23% of Canadians, or 1 in every 4 of us, will be 65 or older. What are the top issues for seniors?
Poverty.
Why do you say poverty?
Well, because there's so many people that are out of jobs. Some people are disabled, you know, because even seniors would like to work, light work, if they can get to do it, you know.
Oh, I imagine affordable health care would be one of them in terms of like retirement residences and things like that.
I think getting into elderly homes, there's not enough space for them, and it's also very expensive, and not a lot of them can afford it. And I think that there should be more resources for them, like maybe the government of Canada should put money in effect for them to get into homes easier than what they're doing right now, because I feel like a lot of senior citizens die early because they don't get the help that they need because they can't get into the homes, because they don't have the money to get into them.
The top issues for seniors in Canada today are
I would say health care. Some seniors are in need of decent, affordable housing, and then there's assisted care living.
Probably cost of living and stability, in terms of they're the ones thinking about their future the most, and the fact that they don't have they may not have enough for retirement, and that kind of thing, right? So I think that's probably what they're thinking.
At 65 years old, Canadian citizens or legal residents are eligible for OAS or Old Age Security. This monthly benefit has a maximum of $600.85. CPP and RRSPs are also common forms of income for seniors. A recent poll by the CIBC found that 90% of Canadians not yet retired had no detailed plan for their life after work. And 32% of Canadians on the cusp of retirement told the bank they have no retirement savings at all. How can Canadians best prepare for retirement?
I think learning about their options, learning more about how to keep themselves healthy if the plan is to stay at home, being really preventative and seeking health care when they need it, having discussions with family members, and also financial planning starting early.
Ooh, I'm almost there myself. Yeah, I'd say save as much as they can. Most of us, I'm 60 years old now, and I'm starting to wonder if I have enough money to get me through, because everyone's living longer now. So if a guy can live another 25, 30 years after he retires, you need a fair bit of resources to get you through that time. So I don't know too many people that feel they really have enough. There's a small percentage that do, but I think most of the guys, baby boomers my age, we're all kind of talking about whether we have enough money or not. That's a big concern. So you got to start early, and save and get it into your RSPs and live within your means while you're young, so that you have enough when you get old. But yeah, that's a big concern.
Don't do like I did. Save some money. Get RRSPs, definitely. Pay off your house as soon as you can, and save enough money to enjoy your retirement.
This is something that I actually look forward to, being a university student. Like I want a job that has a good pension plan that is associated with it. I want something that, while you're in school, you're working towards a job, and when you're working, your goal should be to save up enough money to retire comfortably. So I feel like Canadians should keep that in mind, especially when looking for jobs, and making sure that they have enough of a part of their income put towards retirement or pension.
I haven't really prepared for my retirement. I'm planning on working all the way up until I can't work anymore. So I think maybe a lot of people are doing that who can't prepare for their future.
I think we need to start our retirement funds early, and I think there needs to be more education on that for people our age.
Yeah, I think people need to start working on their RRSPs and saving money while they're in school, rather than just waiting till after. You're building so much debt during school, you may as well set aside a little bit of money if you can, so it's easier to pay off in the future.
Put away your money. Keep your savings account available. I know I already started investing into that kind of stuff. Putting away, even if it's just $10, $20 per month, especially as university students, it's really important to start preparing, or else you'll find yourself later in life not ready.
And I know some buzzwords are like RRSPs, but I know that's sort of easier said than done. Yeah, maybe not renting your whole life. Yeah, buying a house, buying some property. Yeah, I don't know when that's in the books for me, but yeah.
I think whatever you make out of the present moment is what truly creates your future. And as far going that far into the future, we're not there yet. It's non-existent, the only moment we really have is here right now, and by focusing on what we have here right now and whatever we choose to do with the here and now is what will really put us on the right path. But I think a lot of it has to following your heart as well, just kind of trusting yourself, and also envisioning things, having those dreams, not being afraid to just go for it and just believe.
It's really about owning what you're
retirement's going to look like, right? So you have to invest. You can't depend on the government to take care of you. You can't depend on that's going to be there for the long term. The financial scenario that the government has got themselves in with the debt scenario means that it's long term. It's not supportable. There's not going to be enough younger people coming up in order to support the older people that are going to live longer and longer. So you have to make sure that what you have saved up, what you've done with your finances, what you've done as far as your debt scenario and things like that are going to be supportable into your old age.
That's a good question, because I was talking to a friend of mine. I said when we save money on the side, something like the tax-free savings, or you have a lot saved on the side, it's considered as another salary. So even as much as you save on the side, the government will still go into it and take more of your money. So no matter where you do, like us, sometimes we do something called susu. Within a group, we were saving money, like every week, 200 and then stuff like that. So we save on the side without putting it in the bank. Because everything in the bank, the government's eyes is on it. So I think that's the way that I would save. Like the susu money that I'm saving, that's the one that I'll rely on.
Get into a pension as soon as possible. I've got a pension. I started when I was 19. That's back home. Obviously, I'm not paying into it at the moment while I'm here because I'm on a 2-year holiday visa, but I'll definitely be paying back into that when I go home. It's only like £20 a month or so. It's nothing.
It's like 5%, something like that?
Yeah.
Yeah.
It's nothing.
So like, so you're talking about like a superannuation fund, something like that. Yeah, no, like is that not the go? Like, is that not like a super sort of substantial thing here? Like, does everyone not have like a superannuation? No? In Australia, it's more, everyone gets 11 to 12%, no matter where you are, no matter what company. Like you get 12% superannuation just by industry standard. But I play music for a living, well, in Australia, and I set up a superannuation account and stuff like that. But like doing it by yourself is a lot harder than just doing it through another company. But it is crucial. Like it scares me to the fact that I've been working all these years and I haven't been putting money towards a superannuation fund. And like the thought of like when I get to 40, if I might not have that much money in terms of what I could have had if I started earlier, it scares me. It genuinely does, because like, what am I going to do when I retire?
Or if we retire.
If we retire.
Yeah,
we don't die beforehand.
Well, I imagine those that have no income coming from a company or an institution that doesn't participate better take looking at it right now and take either RSPs or some kinds of savings, because the cost of living is going up every day and it's really expensive. I'm looking at retiring myself, so I think I know a little bit about it, and I've been looking at it, and I think I have a few more years to go, even though I'm only 75.
You want good care, and if you need it, and you want a suitable place to live, comfortable place, and when your need comes to be nursing, then I think you should plan ahead, and have an idea of where you want to go and what your needs are.
What do you think about the snow?
We were expecting this time of
We
year.
were expecting it, you're right.
The Mount Continuing Care Community is a community seniors residence, and we have about 100 people who live here. It's a former convent, and so it was converted about 4 years ago into a long-term care facility. We also wanted to include lots of other activities from the community under this one roof.
It's really rewarding to have a place like this that you can come and feel at home and be at home. Being here, it's very, very great place to be. You don't get this too often.
We get phone calls daily, weekly about wait lists. When can we get in? Our mom is waiting, and they're waiting in hospital. And our hospitals are wonderful for acute care, but they're not designed for long-term care. And so having more beds in the system is really what these people need. This is what's appropriate for the level of care that they need.
A lot of them here are very happy when they have friendships, and they have in the dining room, they really come together as a group, and they're very happy, I think. So that would be, it would come from within, so it would be a bonus to them to keep their attitude happy.
Just accept what comes?
What comes, part of the journey that we're on.
We have 30 long-term care beds, and we've just recently been awarded an additional 20. So as part of our addition, we will be expanding our long-term care beds, which is a need in the province of PEI.
Way back, as maybe you would know this, in the 1960s, government started building seniors' homes at that time in different communities. That has kind of passed because the seniors don't seem to want to live in small communities, they want to live in larger areas. But the government was involved then with that, and I don't see why the government shouldn't continue to be involved with building seniors' homes and affordable housing, and private, and private people can do it as well. But how do you, it's hard to control what the private people will charge or what they will, they have to make a profit.
The privates end up being too expensive, people are going to have to go to the public. But I think there should be really good care. You have to make sure that there's really good care, good quality nursing care, that the residents, or whatever you want to call them, are being treated appropriately and respectfully. Private to me seems like more expensive to live, and public seems more affordable for the average person.
With the public, I don't know if it has that quality of being part of a friendship community like we have here. But, you know, I don't have that experience of living in one. But here, they offer, it's like a home away from home for many.
Should the government be focused on supporting private or public nursing homes?
For private nursing homes, it would be more about profit rather than about giving people the care that they actually need. Whether, on the other hand, looking at public nursing homes, it's more about keeping people safe, making sure they have a place to stay after they retire.
Just having family members in private, it's expensive, but with public, that's public money that causes issues as well. I think they should be looking at both equally. There are benefits to both, but there are also negative points on either side too. My grandmother was in a public one, and it was kind of awful. So, but I can see the issues with private as well, being super expensive for people to afford. If someone's going into a home, they're obviously budgeting already, and the family's responsible for it. So to be able to find something that's cost effective is hard.
In this day and age, and based on my years, my age, I'd prefer to see public nursing homes, publicly funded.
Yeah. Why?
To some degree. Because of the aging population, we're all going to be in that situation soon, and it's probably going to be overwhelming for a vast majority of Canadians, because I don't think most are prepared for the cost that's going to be involved if it's solely private.
If you can afford a private nursing home, but they're all pretty expensive. So if the government can subsidize a bit, that would help, but public as well. They need to be kept up to date and in decent shape as well. Yeah, so.
Yeah, I pretty much agree with the same. You know, like there needs to be a choice, but also public awareness. I think that you know, there needs to be a better program by the government, letting people know that they should prepare for retirement and what the different stages are. Everyone sort of pushes that aside, and they don't really, there's not much education, and just sort of like fall into it. And it's better to plan what's ahead of you than make something else make your plans.
The way that pension plans are paid out and everything, a lot of individuals, people do not have the sufficient funds to go into a nursing home. I'm taking care of my mother, who's 98 years old. She's at our house, so I think they need to do something.
Great question. We're talking about this in my own family right now. I think the ideal would be for a public system that would help everyone and cover everyone, and to let people with more money jump to the front of a line to a better place doesn't seem right.
We have an aging population, so that's going to be a bigger issue.
in the future. I think we already see public dollars are stretched. So I think the reality is it's probably going to be a public-private partnership of some format, and those who have means are going to gravitate to a private system. But I think even in a public system, we have to consider how we take care of those in our population that are aged.
My name is Dr. Victoria Burns. I'm an assistant professor at the University of Calgary's Faculty of Social Work. I'm interested in housing and homelessness amongst seniors. Basically, it dates back to my childhood and having grown up with my great-grandmother in the home and being very close to my paternal grandfather, whose birthday is actually today, so he would be 110 years old today if he were still alive. And always feeling a special connection to older adults. My great-grandmother had to move out of our home into a long-term care facility, how devastating that was for her, and the same for my grandfather. So this idea of home and homelessness is a passion for me. We hear all the time we're in a period of demographic aging, gray tsunami, all of these different terms, but what's not actually really talked about much is how much poverty there is amongst older adults. And that's what this Beyond Housing documentary is about. It's highlighting these 7 intimate portraits of diverse older adults with histories of homelessness, because there's no one-size-fits-all housing solution. There's no one type of quote-unquote older homeless person. So here is, a range of experiences.
Yeah, I became homeless. I can't recollect as to what year it is, but it was only a year and a half after coming to this country.
There are 7 participants total with very diverse experiences, and we're talking about difference in terms of sexual orientation, race, ability, disability, so mobility issues, and addiction, and looking at their experience of finding home after homelessness. So a person who is 50 tends to have the health status of someone who is 10 to 20 years older. So this demographic is aging, people who were chronically homeless, but also there's a new face of homelessness, so people who are experiencing homelessness for the first time at age 50 and above. So we're looking at about 50% of shelter residents are now age 50 and over, and there's nowhere for them to go. The recommendation is we need more social housing. But there hasn't been any leadership around that from the federal government until recently, until last year. So part of my job as an academic is to be able to provide the evidence. We need the data to show to the policymakers who are holding the purse strings. And I think what was the biggest takeaway was the community that was created through this film amongst the participants. They have a Facebook group. George actually, unfortunately, passed away last week. We're hoping that this documentary will shed light on the low-income seniors and just change the perspective about it, because that's the first step as well, is first raising awareness, which we're hoping that this documentary will do, and then shape policy as well.
Thanks for watching this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you'd like to weigh in on this episode or any other episode you've seen, our email address is outburst@cpac.ca. You can also find us on Facebook. It's your turn to speak up, and we're listening.